welcome back with me, Miss Rani. I hope you are always in a good health and, of course, still stay at home. Today, I want to discuss about anxiety. What is anxiety? Anxiety is a term used to describe a normal feeling people experience when faced with threat, danger, or when stressed. When people become anxious, they typically feel upset, uncomfortable, and tense. Feelings of anxiety can be a result of life experiences such as job loss, relationship breakdown, serious illness, major accident, or the death of someone close. Feeling anxious in these situations is appropriate, and usually we feel anxious for only a limited time. Because feelings of anxiety are so common, it is important to understand the difference between feeling anxious appropriate to a situation and the symptoms of an anxiety disorder. Anxiety disorders are not just one illness, but a group of illnesses characterized by persistent feelings of high anxiety and extreme discomfort and tension. People are likely to be diagnosed with an anxiety disorder when their level of anxiety becomes so extreme that it significantly interferes with their daily life and stop them doing what they want to do. And the most suitable case with this topic discussed is case study 17. The title is Informed Consent. I will read case study 17 first. Case study 17. Informed consent. Mr. S, a 56-year-old male, consulted his family physician due to respiratory problems. After X-rays revealed patchy infiltration of the lung, Mr. S was referred to a respiratory specialist who determined that the condition was bilateral and recommended an open lung biopsy, which Mr. S refused to undergo. After Mr. S' condition further deteriorated, he was referred to Dr. D, an internist specializing in respiratory disease. Dr. D observed that Mr. S was exceptionally anxious upon examination. The doctor's initial diagnosis was progressive pulmonary fibrosis of the interstitial pneumonitis type, probably involving fibrosing alveolitis. A biopsy was required to confirm this diagnosis, but Mr. S continued to refuse to undergo an open lung biopsy. Dr. D then suggested an alternative procedure known as a Trevin lung biopsy. This procedure was inferior to the open lung method, but in view of Mr. S' refusal to undergo the open lung biopsy, it was an appropriate alternative. Dr. D explained to Mr. S that the procedure involved the administering a local anesthetic and then inserting a special needle into the lung while the patient sat on the edge of his bed. He also told the patient the needle would be attached to a drill. Dr. D then outlined the procedure's risk, advising Mr. S that the procedure was usually virtually painless but did have two possible complications. Dr. D did not mention to Mr. S that the procedure also involved risk of perforating the spleen or the liver, an uncommon risk but not as uncommon as death. Apparently, Dr. D was not aware of this risk. Mr. S consented in writing to the trephine biopsy procedure. Prior to the procedure, Mr. S was anxious, apprehensive, and nervous. He told Dr. D he could not afford to die. He was given atropine and sedated with normal and accepted doses of morphine. Once Mr. S had been sedated, Dr. D gave him instructions and demonstrated the equipment to him. After a local anesthetic was administered, the operation began. At a critical juncture, Mr. S was directed to hold his breath. Instead, Mr. S winced and moved, causing his spleen to be perforated. Dr. D told Mr. S that the required tissue sample had not been obtained, but did not yet disclose that the spleen had been perforated. When Mr. S asked Dr. D what he had obtained from the biopsy, he answered something else. It soon became painfully obvious that Mr. S' spleen had ruptured and had to be surgically removed. The question from my lecture that I should to answer about this case study is taking into consideration that Mr. S was an extremely anxious patient. Should the doctor have acted differently with respect to the explanations he gave to Mr. S? My answer is no. Dr. D acted properly and did not breach his obligation to provide Mr. X's explanation about the procedure. All the explanations that should have been given before the procedure were provided. Determining that this behavior constitutes a breach of a physician's obligation to his patient would increase the liability on physicians to an intolerable level. And my opinion is no one can guarantee positive outcomes in healthcare settings, but informed consent at least ensures patients understand the risk they undertake with treatment. It is also the law. When patients agree to a treatment, they must sign paperwork indicating they understand the risk and agreeing doctors can take specific life-saving measures if needed. Informed consent creates trust between doctor and patient by ensuring good understanding. It also reduces the risk for both patient and doctor. With excellent communication about risks and options, patients can make choices which are best from them, and physicians face less risk of legal action. So that is my answer of this case study, and thank you.